About the 24-hour shifts. Like, is that like a
is that real?
Real the real thing?
They're asking for pain meds. I literally was like, I didn't even get a chance to read the chart. And then someone's calling me. They're like, "Yo, we're gonna call a rap if you don't get here. If you don't get down here soon." And I was like, "Bro, like, I don't even know what to tell you." Like, and we were just scratching. We were like, "Yo, I don't know what to do. Like, this is OD." Like, we were like, "Yo."
Now there are a couple more questions I want to ask about internal medicine.
Oh yeah.
But it's a little more interesting, I think. So So I think the first thing is so I hear this a bit. You know, I hear people talk about it, and I'm like, almost in like a rumor type of sense, and I'm like, is this actually true? And I kind of got a doctor on the podcast to answer.
Oh, let's go.
But like, so I do want to ask about the 24-hour shifts. Ooh. Like, is that like a
is that real?
The real thing?
Yeah, 24-hour shifts are real. Not in my program though. But they're real.
Okay.
Depends on where you go.
Okay.
Yeah, my program, the most we do is like, I don't know, like 7 to 8.
Really?
Yeah, it's like a 13-hour shift. That's like the longest we will do.
Oh, okay.
Actually,
okay.
I'm wrong. The most we'll do is like, yeah, no, it's a 13-hour shift. Yeah. 13-hour shifts. That's the most we'll do. But I know other programs do have 24s, but then you get like the next day off or whatever.
Okay.
I don't know. I feel like it's fake because you have to stay a little bit longer. Yeah, it's kind of
annoying. Okay.
So yeah, that's definitely real.
Yeah.
But that's more common in the surgical specialties though.
I see. Yeah. I see. Got you. So how do you feel like balancing that with, whatever other aspects of life has kind of been for you?
Honestly, like, it's not bad. It's not bad because there's less studying. Well, when I say there's less studying, like med school, you're studying. Like, you're studying,
Full sessions. Yeah.
During residency, like the studying is like, I'm just gonna go on up to date real quick and like just quickly like look over the management of this condition. Like that's like the studying. Like it's not like hardcore per se because you're kind of learning on the job, and then you review going on up to date or whatever other source you might use. So the life balance is a little bit better. The days are long though. And when you're at work, you're working, and you're tired. Like you're physically tired, you're emotionally tired, like you're just tired, because you're giving yourself to your work. You're really just giving yourself emotionally. Like you're having goals of care discussions, end of life discussions, dealing with patients who might be agitated or they have like very negative experience with the healthcare system, and then they end up unfortunately taking it out on you. Like it's nothing personal, but like you just become the face of medicine, so they're going to use you. Like a lot of these different things every day, so it's like it's very emotionally draining. You have to separate yourself or else you get burnt out really quickly. So once you get home, a lot of people just chill, man. Like it's just really like it's very needed.
Yeah. So even going off of that, because you mentioned really kind of like all the different things that go into just like a regular day in terms of what you particularly do, I do want to ask you, what do you feel like was perhaps the most or one of the most memorable experiences you've had like with like a patient encounter, without violating HIPAA, but like, yeah.
Most memorable, I have a couple different memorable ones. Let me think. Most memorable. I have a couple. So one day I come in and my patient is in the ED, so they didn't get a bed yet upstairs. They're still in the ED. I literally just like signed into the computer. I got like 10 messages because I got assigned to the patient before I even got in. So like everyone's messaging me like patient's agitated, blah blah blah. Like they're asking for pain meds. I literally was like, I didn't even get a chance to read the chart. And then someone's calling me. They're like, "Yo, we're gonna call a rap if you don't get here. If you don't get down here soon." And I was like, "Bro, like I don't even know what to tell you." Like, and like the way it works too is that once they're assigned to medicine, the ED team is like very removed. They're very much like, "Yo, this is your problem now. Like you deal with it," because they're also very busy.
Yeah.
Like they're very overwhelmed. So it's like, I get there, this patient like they're very upset. They take her smearing it all over the floor and the wall. It was crazy. And then everyone's looking at me to do something. And I was like, bro, I'm just an intern, man. Like, it's just my first, this is literally like my second month. Like, bro, like it was crazy.
Oh, no.
Stuff like that. Honestly, stuff like that is just jokes. Like, another time, one of my patients, similar story where they wanted pain meds. And the team, we were discussing it. We thought they might have been malingering. You know, we thought they might have been like had some kind of secondary gain from it. So we were like, nah, like, you know, this is not you don't have a pathology right now. Like, you're just kind of seeking medication. And then we walk away. One of the nurses spots the patient inducing vomit. Like, they put their finger down the throat, inducing vomit in the bag. I come back to talk to them. They start shaking the bag like this. They're like, oh my God, like, they're very upset, shaking the bag, and they throw it in the air. And the vomit splashes on the security guard. Bro, I felt so bad. I felt so bad. It was disgusting. So I'll never forget that.
Wow.
And then more on the pleasant side.
Okay. Yeah, I was going to ask about that.
More on the pleasant side. One of my patients, basically, like, very convoluted psych history, doesn't trust anybody. Like, it was very hard to interact with them. It's one of those things where you have to, like, become their provider throughout, like, with familiarity. A lot of these kinds of patients do well with familiarity. So I saw this patient every day, same time every day, same questions, you know, same everything, just to keep regular stuff, very predictable stuff. Yeah. And I thought it was cute because they only wanted me there. Like, every time I left, they would start freaking out, headbutting people, biting people, and then I'll come there and then they'll calm down. It was very cute, I thought. It was nice. And it got to the point where I had to get a computer and just kind of, like, stay with the patient on the floor and just do my work next to them. Yeah, I thought that was cool. What else is there? I'm trying to see if I have any cool ICU stories. I guess one time a patient gets transferred from, like, a different facility. Basically, they had a heart attack.
Oh, okay.
And that facility didn't have the capability to do the standard treatment. So they gave something that was non-standard. Oh, this is my first time experiencing this. I was, like, blown. Like, basically they come in and usually you're supposed to do, like, a cath, you know, all that kind of stuff. They didn't have the capability to do a cath, so they did TPA instead.
Okay. Yeah.
So this guy starts having a massive GI bleed. Like, it's crazy. It's crazy. Like, the bed is like a river of blood. And then it happened like 3 times overnight. And so it's just me and my senior. And we were just scratching. We were like, yo, I don't know what to do. Like, this is OD. Like, we were like, yo, like, I think that was one of the craziest nights for me because we were literally just, like, so scared. Like, the blood pressure was like 70s, 80s, systolic the whole night. Like, oh my God. It was one of the craziest things. Like, we were just, like, by the room the whole night just watching them. Like, they had, like, 3 episodes of massive GI bleed. We couldn't do anything. Like, we were transfusing them and just kept on bleeding, kept on bleeding. It was crazy, man. It was crazy.
Oh, okay.
And we were just kind of keeping them alive until the morning.
Oh, okay.
Yeah.
Wow. Yeah.
So I think that was pretty memorable for me. Yeah.
Wow, yeah, that's interesting for sure.
Yeah, no, ICU has a lot of stuff.